Depression is one of the mental disorders that is affecting millions of people worldwide. And among the many drugs that have been discovered, citalopram is one of them. Citalopram belongs to the selective serotonin reuptake inhibitors that works by preventing the absorption of serotonin levels in the brain. So it blocks nerve cells from quickly absorbing the serotonin levels in the brain. And then this increases the concentration of the serotonin in the brain, and then it helps to regulate mood and also to treat the major anxiety disorders. The chemistry or the structure of citalopram has key functionalities that enhances the activity of the drug. The core structure of the drug is a benzofuran ring, and also there is a dimethylamino group that helps in the solubility of the drug. There is also a fluorophenol group that enhances the receptor binding activity of the drug, and there is a nitrile group that influences the drug's pharmacokinetics. In 1972, 𝐂𝐢𝐭𝐚𝐥𝐨𝐩 discovered or first synthesized the drug citalopram as an alternative to be used to treat depression.
Talking about the mechanism of action of citalopram, citalopram exerts its antidepressant effects by inhibiting serotonin transporter, which is responsible for reabsorbing from the synaptic cleft back into the presynaptic neuron. By blocking the reuptake mechanism, it increases the level of concentration available in the synapse. This enhances the serotonergic neurotransmission, which is responsible for improving the mood, reduce anxiety, and as well as better regulation of emotional response.
Uses and applications of citalopram. Citalopram is primarily prescribed for the treatment of general anxiety disorder, major depressive disorder, panic disorder, and obsessive compulsion disorder. However, it has been observed for the off-label treatments, such as the treatment of PTSD, premenstrual dysphoric disorder, and menopausal symptoms. It is also used for the treatment of pain, such as the pain chronic disorder.
Toxicity is a key concern when it comes to using citalopram. When citalopram is used beyond the recommended dosage, two most common toxic effect that happens to the patient is one, cardiotoxicity, and with this it increases the QT interval of the person. That is, it increases the chances of the person getting cardiac arrest. Two is neurotoxicity, and with this it increases the chances of the person getting seizures. To ensure safety, health professionals uses various guidelines to make sure that safety is achieved, and two most common that they use is they use prescribed or recommended dosage for the patients. For normal patients, they give them 40 milligram per day, and then for older patients and people having hepatic or liver issues, they give them 20 milligram per day to ensure safety. Despite the effectiveness of this drug that is citalopram, there are some challenges that this drug also brings, and one among them is delayed onset of action. And with this, it is being reported that when some patients take this drug, it takes about 1 to 2 weeks before the action of the drug is executed. Another challenge is that for some patients, they do not respond to this drug at all, and this can be attributed to genetics problem. Future directions. Researchers are now researching how they will use this drug on individuals, and with this I mean that they will look at the genetics makeup of the individual, and then they will provide the specific drug. Again, researchers are now looking into how AI will help to develop the usage and then the effectiveness of this drug. Thank you.